Council, thank you for inviting me to address you on behalf of UNISON. UNISON agrees that Darlington Borough Council and the NHS both face enormous challenges imposed by government public funding cuts. However, UNISON is very concerned at the lack of evidence-based information available as part of the STP. What are the next steps to be taken in the STP? Who will manage that change process? And how will those implementing the change be held to account? UNISON is the largest trade union within the health services. UNISON is already involved and coordinating the Workforce Action Group, ready for staff consultation via the North East Social Partnership Forum. But where will consultation be for all stakeholders in the STP? Will that consultation be wide and meaningful? Governance and scrutiny. What system of governance will be established for the STP? And how will local democratic accountability work? How will the views of staff, patients and public be heard and considered in the further development and implementation of the STP? What level of scrutiny will be maintained on the STP through the Health and Wellbeing Board or the Health Overview and Scrutiny Committees of Darlington Borough Council? Accessibility. The STP is focused upon financial efficiencies, including closure of an A&E and other services. Councillors, you have the responsibility for public transport within Darlington. How will accessibility be ensured for local people who need to access vital health services at a distance out of the area but within the STP footprint? Financial risks. The figures included in the STP do not stand up to scrutiny. What savings are double counted as part of existing expected efficiencies? What parts of the savings are reliant on cuts to services, staff pay and terms and conditions? There is a funding gap. What reliance is there on transformation funding from the centre? There's a need for risk analysis. We need a firm study on the likelihood of the STP coming to fruition. What problems may be encountered along the way? And what extra capital spending and investment is needed to achieve the STP? Equality. The most vulnerable and less economically advantaged will suffer the most following service closures. There's a need for an equality impact assessment to analyse the impact before efficiencies are planned. For example, what are the most pressing issues for local staff and the services they provide in Darlington? Has this been clearly costed within the STP? Workforce. STPs are supported by additional schedules of more detailed information, but these are not generally made public during the consultation stage. And that's precisely the information we need available as part of full consultation. What will be the impact on NHS staff members who currently work, live and support the local economy in Darlington? We need a workforce schedule. How many staff will be affected by the STP? What jobs will be lost? Will any be created? What flexibility will be required of staff? What consequences are there for the workforce? What skills and staff will be required by Darlington Borough Council to make the new care model a reality? An emphasis is made in the STP that efficiencies are expected from moving care provision out of the hospital and into the community. Councillors, you are the provider of social care in Darlington. What is Darlington Borough Council's honest assessment of how their responsibility for the new model of integration will work, and how will it deliver efficiency savings as part of the STP? Thank you for your attention.